everyone. It is your virtual sports chiropractor here, Dr. Heather, and I wanted to actually talk to you guys about tendinitis because I think a lot of us may be like doing some training and stuff like that, and then all of a sudden we get an ache, we get a pain, and we're like, oh, I think I have tendinitis, but you actually don't know if you have tendinitis. So let's just go over some basics, before you start kind of scrolling YouTube, before you start kind of asking that question out into some of the Facebook private groups, and getting a whole bunch of different types of answers and really starting to feel like, oh my God, I'm so overwhelmed. My head's about to explode. I have no idea what I have, and just kind of want to get a basic understanding of what it is. That's exactly what I want to do for you guys today, is give you that basic understanding. Now, if you've seen some of the videos on the channel and you like them, go ahead and don't forget to subscribe to the channel. As always, greatly appreciated. And if you're looking for more in-depth information, I highly encourage you, book the free consult with me. There's no obligation, there's nothing that I want to do more than just try to provide you some insight, give you a solid game plan, and if you choose to work with me, great. But if not, at least I know I've tried to help you and give you some better understanding of what's going on with you and your condition. All right, so like I said, I want to go ahead and really start to talk to you guys about tendinitis and what it is. So we're going to get right into it right now. I'm going to pull up the next slide so you guys can see as well. So tendinitis, okay? Itis always means inflammation. Tendon, obviously, we're talking about a tendon. So with the whole word combined, we know it's an inflammation or irritation of a tendon. Now, tendons are actually thick, fibrous, cords that attach the muscle to the bone. So you have the muscle, then at the very end, you have the tendon, and then where the tendon meets the bone is the ligament. Okay, just kind of so you guys kind of have an understanding, that's kind of that relationship there. And then there are just some ligaments that do attach themselves from bone to bone as well. So now, with this being said, the condition here of tendinitis can cause pain, can cause tenderness to the outside of the joint, okay? Now, when this happens, the most common areas we see this, and if you are one of my many runners, you may have experienced Achilles tendinitis, okay? And that's where you're noticing more of some discomfort when you're pushing off the foot and you're wondering if it's like a calf strain, not sure what to do. The other areas where you can notice tendinitis is actually in the elbows, shoulders, wrists, and knees. And for those that do play tennis, I'm going to be putting together a elbow tendinitis video and giving you guys my actual personal treatment protocol that you can use to help you with elbow tendinitis. So do pay attention for when that video does come out. Now, what's the treatment? Okay, so listen, with everything, we want to start off with basic treatment protocol, okay? So as always, if an injury has set in, if you're noticing something doesn't feel right, and if you're an athlete, if you're somebody who truly enjoys exercise, you probably have an innate sense of when to kind of ease up and when to maybe try to push through a little bit. With a tendinitis, you definitely want to ease up. That is something you right off the bat want to allow those tendons some rest, period. And you want to make sure that you give it a prolonged rest period, not just like overnight. You do want to kind of give it its attention. Then the other thing is you may need to go ahead and, if you're particularly training for a specific event, you may want to go ahead and switch it up a bit. So this is something I tell all of my runners, yes, it's great to run every single day, but you do want to go ahead and give yourself those rest recovery days. They're hugely important. And then it is important to do some strength training, kind of give certain muscle groups a chance to relax, to kind of quiet themselves down and work some of the muscles that, or, ligament tendon areas that you normally wouldn't. Now, the other thing is too, this is something where we look at ergonomics. So we can look at your running form, how you're moving on the court, on the field, looking at your overall technique. And if you are developing a tendinitis, maybe, it's more from weight training, weightlifting, you do want to look at your technique, your form. So this is where you would want to kind of break down your biomechanics and have a better understanding there. Now, I do not stretch after every run. I come home, I'm hot, I'm sweaty, I need to eat, I need to get to work type of deal. But I will say, if you are somebody who does happen to be more prone to injury, more of a tendinitis type of issue, you do want to learn how to incorporate the stretch protocols that are going to be appropriate for your injury. That is something that's going to really be huge, because a tendinitis happens to be like repetitive trauma. It's constantly happening again. And we sometimes see this with like a carpal tunnel tendinitis, where you're noticing, because you're using the mouse so much, that it's a repetitive action. So this is where having a good stretching protocol put into place is going to be helpful. And this is where I would say to you guys too, on my channel, I have a ton of different types of stretching programs that you can do, from dynamic to passive to resistance. Take a look at those, ask some questions. I'm happy to inform you of what's going to be more appropriate for you. As always, if your tendinitis is obviously due to working from a computer desk at home or at the office, make sure you got the proper ergonomics. It is going to help you kind of really enjoy life 10 times better. And then also too, as always, you want to make sure that you are doing the proper strengthening activities that go along with that injury. So I think you guys have heard me say many, many times before, we want to work on our flexibility and mobility. So we want to break down the tissue first. And this is where I tell everyone, I'm a big fan of myofascial release, big fan of foam rolling, massage ball. If you get in there and you start really breaking down the tissue, you understand how to really utilize that myofascial release properly, incorporating in some really good passive stretching, you're going to notice that the tendinitis is going to subside. But then the next part is to look at those biomechanics, look at those muscle firing patterns, and understand how to really strengthen your body appropriately for your specific injury. So again, if you haven't booked that consult, that call with me, and you're having questions about your specific tendinitis, I highly recommend that you go and you visit our website today, askdrheather.com, and make that appointment with me. Again, there's no obligation whatsoever, but I want to be able to help you. And the only way to do that is to really kind of talk to you, see what's been going on, and really kind of give you a better action plan so you can know what to do next. Now, if you've gone ahead and you've liked some of the material that I've presented in this short little video today, do give it a thumbs up. And if you haven't subscribed to the channel, please go ahead and do so. All right, everyone, this is Dr. Heather, and I will see you in the next video.